Good afternoon. Good afternoon
Good
to the
afternoon.
Sickle Cell Warriors. Thank you, Miss Wright, for your introduction. I was here sitting and saying, wow, she talking about me, but I am so happy to be here with you today. It is indeed a pleasure um, to be presenting, on the benefits of the National Health Fund and specifically the benefits that are, specific to sickle cell patients. I want to acknowledge the presence of your president, Ms. Camille Daly, and all the other members of the sickle cell community who are here with us. All right, so let's just get into the presentation. So let me just share my screen with you. Are you seeing my screen?
Yes, we are.
Great, great. All right, so as you notice, I wanted to make it specific to sickle cell. So we even got some sickle cell slides. So we can all feel, the whole vibe of it. So the vision of the National Health Fund, as you probably, those who are keeping tabs, no financial barriers to healthcare. And of course, you understand exactly what that means. It really means that we are committed to ensuring that the persons who are most needing of medication are getting that help. Our mission to provide funding for specified healthcare benefits, health promotion, health projects, and pharmacy services in a sustainable, efficient, and customer-centric environment. And of course, we are big on customer service, and we really, really want to ensure that our beneficiaries are happy and are being well taken care of. So some of the services provided by the NHF. So we have, they're divided into four. We have individual benefits, which would be providing direct assistance to patients, which we're gonna be speaking much about individual benefits tonight because that is where the sickle cell benefits would actually fall. Then we have institutional benefits where we provide grants for healthcare projects. And we have health promotions. You would have seen quite a few of our different promotions where we promote healthy behavior. You would have seen quite a few of those on our sites. And of course, we have procurement, distribution of pharmaceuticals. That is where we supply pharmaceuticals to public health facilities and our drug serve pharmacies. So just a bit on procurement and distribution of pharmaceuticals. And this is heavily weighing on our drug serves. And we're just giving you a bit of everything. So wherever you can fit in, you can get the information. All right, so drug serve pharmacies are public sector pharmacies and they're owned and operated by the National Health Fund. In total, we have about 106 drug serve pharmacies through full-time and scheduled services. So what drug serve does, it supports Jamaicans who depend on the public health system for their medication. And of course, the public health system means our health centers and our hospitals. All right. And we have put some creative solutions in place, like our schedule refill, quick prescript app, The mobile dispensing unit is really in our hospitals. That is really if you are, admitted. And of course, we are always working to reduce our wait times and make our service better. All right. So some sickle cell benefits that you would have gotten under the drug serve program. So for those who know this, I'm sure you're happy. And for those who don't know, it will make you especially happy tonight. So sickle cell patients who are enrolled in the sickle cell unit at the University Hospital of the West Indies can fill their prescriptions free of cost at any drug serve island wide. And of course, that really is that benefit in a nutshell. Of course, if we have questions at the end, I am prepared and ready to take your questions. So just write them down and I will attend to those. So the Quick Prescript is really an app that is downloaded, and it's a way that you can send your prescription to to the um, to the drug serve. The Quick Prescript at this point, it only takes a government prescription. So it wouldn't take the UA prescription, because as you would have understood, that partnership came about afterwards. But of course, if you do have a government prescription, you can send it through the app and select the drug serve that you would love to have your prescription filled. All right, we do have an Ask Your Pharmacist service, and this helps answer questions about the medications that we have available at the drug serve pharmacies. And as you can see on slide, the times, and you can see the contact numbers. So this is particularly beneficial for those persons who may even send their prescription through the Quick Prescript, and you have not interfaced directly with a pharmacist, and you want to get some information about the medication that you just filled. So this benefit would help you in that regard. We have our drop-off pickup service, and this is where you can go to a drugstore of your choice and drop off your prescription, and you will get a time to come back and pick up. Schedule refill prescriptions for those patients who have chronic prescriptions, meaning that you have 6 months, 3 months, 6 months or more on your prescription, and so you would get a time each month to come back and fill your prescription. A card would be attached to the back of your prescription. The date would be written on it, and of course it will help to guide you to ensure that you remain compliant with your medication. All right, so we're going on now to individual benefits of the National Health Fund. And this is where you would have gotten your NHF card and you are now able to swipe and get a subsidy on the different drugs treating your illness. All right, so the NHF has a list of 28 chronic conditions. So it was 24 up to a month ago. We launched 4 conditions on the 18th of March. We launched bladder cancer, heart failure, and we launched inflammatory bowel disease and chronic obstructive pulmonary disease. And of course, you can see sickle cell disease right up there. So in total, we have 28 chronic conditions. And I'm just going through these quickly. All right. As you can see, this is our NHF application form, and those of you who would have applied for your card or have your card would have been familiar with this. I'll just run through it quickly for those who have never seen this application form. So you have section A, section B, and section C. Are you seeing it? Are you able to see the sections? Am I right?
Yes, we are able to.
Great.
But it
Right.
depends on the screen persons are using. If you're
Yeah,
using a phone screen, you might not be able to.
to
Oh,
read it very clearly. Yes, on the phone screen it will be smaller.
it would be okay.
Right, but you
You
guys
can
can
walk
roll.
us through it.
Yes,
Walk you
walk
through it.
us through it.
Fine,
Yes,
fine.
absolutely.
All right, so section A is where you would fill out your information, and you can see you would put your name, your TRN, occupation. If it is that the beneficiary is less than 18 years old, of course the guardian's information would need to go. So the name of the beneficiary who is under 18 would go into the section A, and section B would be the guardian. Of course, the doctor would have to verify that you have the particular condition, and that is done in section C.
A question,
Once
Mrs.
that,
Brown. If
yeah,
you are unemployed, how you deal? If you are unemployed and there's a
yeah,
section for occupation, how is that handled?
you would have put unemployed there.
Okay.
Yes, you would have gone ahead and put that you're not employed at the moment. Just put unemployed. All right. So once you have filled out those sections, you would have taken this application form. All right, let me show you what the back just really gives you information. So there's nothing to fill out on the back. So let's go back to the front. So you would have filled out this application form and you would have taken it to the NHF by New Kingston. That's our head office. Or you could have taken it to Union Square, that's in Crossroads. You could also take it to the drug serve by KPH as well. And you can actually get by KPH, it is actually by the eye clinic. It used to be at the KPH pharmacy before, but it has now changed. So the location is actually that card center is by the eye clinic by KPH. So you would have taken this form there and you can get your card printed within 15 minutes. So it really is quite a short process. The hardest part of it is probably filling out this form, which really is not even hard when you think about it.
A quick question. The 15 minutes turnaround time is
Yeah,
from any of those locations?
any of those locations.
Awesome.
It's a standard. It's a standard, and so it goes across all of those locations. And of course, if you are in other parishes, so Cornwall Regional has same day processing as well. Mandeville has same day processing as well. Who else is here? Who else is here? Whenever mentioned. But in all the parishes, you would have had same card processing areas at the drug serves. So you don't even have to worry about coming to Kingston. You can do it right there in Montego Bay. All right. NHF enrollment by condition. So as you can see, some of our conditions with the highest enrollment would have been hypertension, high cholesterol, diabetes. I just did this so you could get an idea. Even though we have enrollment for sickle cell, it's not one of our it's not one of the higher enrolled conditions, but I'm sure that those who are enrolled are getting their benefits. And of course, by this presentation, those who have not enrolled will do so. All right. This is NHF activity for sickle cell disease, and it's basically just showing the claim value. The claim value is basically the value of your prescription of that particular item at the pharmacy. And so that's that dark blue. And then the lighter blue would be what the NHF would pay. So you realize that you are actually, in most cases, getting a subsidy of about 50% on your medication, on the cost of your medication.
I just want to interject just for a moment.
Yes.
Yes, just to supplement what you're saying. Sickle cell, some of the conditions that persons with sickle cell tend to have
Yes.
may not necessarily be covered under the sickle cell list of drugs. But what I wanted to point out for persons who have circulation issues, like oftentimes, because of the whole issues that sickle cell patients will get with leg ulceration
Right.
and other, other circulatory issues
Yes.
related to the fact that the disease does affect your circulation.
Correct.
Sometimes the doctor will prescribe a drug like Daphlon.
Yes.
Right. No, my understanding is that Daphlon is not listed under the sickle cell list of drugs. However, it is covered under vascular conditions. So there's something on the NHF
No,
for
man, it is
or
it is
venous
covered.
or something.
It is there
Daphlon is
now.
now covered by sickle cell.
Yes, I'm
Okay,
getting to
okay.
it.
I'm okay because I was gonna say that I discovered that at first I was told it wasn't covered, but then because my doctor added something else which is covered, either venous or vascular something, I was
I'm
able
getting
to
to
get
it.
yes, because I was gonna say that I was very surprised. So now I'm glad to know that no, it's covered by sickle cell, but I think
Yes,
at the outset it probably was not. But you could get
right.
coverage under another different, disease category under the NHF.
Correct. I'm going to share the list of drugs because what happens is quite a bit of drugs that are listed on the sickle cell. And so it would have been quite a bit to put on my slide. But I'm going to try sharing the document for sickle cell. All right. So moving
Okay, thank
along,
you very much.
you're most welcome. All right. So we also do have JADET beneficiaries who are also eligible for NHF benefits. We spoke about the 28 conditions that are covered by the NHF, covering over 2,200 items, and our JADET program, which covers 10 conditions with 300 items. All right. So with an NHF card, you basically pay less on a selected list of prescription drugs. Our subsidy list is online. It's on our website, and you can go there, select the drug that you would like, and it will give you the actual subsidy for that particular drug. All right. So you present your card with your prescription whenever you go to your pharmacy, once they're participating pharmacy. And of course, the NHF will pay the fixed amount on your drug once it is covered. And you use your NHF card along with your private insurance if you do have a private insurance. All right. This is now the double subsidy. I'm not sure those who don't know of this one, but this is for persons, our children enrolled 0 to 18 years. And some conditions that are covered. So sickle cell is there, asthma, epilepsy, diabetes, rheumatic fever, sickle cell arthritis. And what this double subsidy means is that it is, as it says, double. So the regular subsidy that we would have given for other beneficiaries, this category of beneficiaries, our 0 to 18 children, would have gotten twice that amount as a subsidy on their medication. All right. So this is the part that we wanted to get to, and these are some of the categories that are covered for sickle cell disease patients. So we have our analgesics. Those are really painkillers. Some that are listed, or diclofenac potassium, which you would have known as cataflam, meloxicam, our antibiotics, which would have been anti-infectives. So you would have been familiar with your amoxicillin, your augmentin, azithromycin. Those are covered on the program. We have our bronchodilators, which would have been our beclomethasone, salbutamol. That's your Ventolin, and your Beclovir. That's the blue pump and the brown pump. We know the colors. And then we have our vascular circulatory that Miss, our president was asking about, and Daphlon is right there. Our high blood pressure, enalapril, losartan. And just to note that I just gave you examples under each category. There are many others that are on the list, but in terms of, it would have been quite a bit to put on the slide. So I really just want you to get an idea of the categories that are actually covered. When I'm finished, I'll try sharing a more detailed document with you. All right. Some other benefits. If you are a sickler and you also have diabetes, you can get a glucometer every 2 years. At the moment, though, you must use your NHF card at least once for diabetic medication. If you're 60 years and older, you can pay a small fee for medication that is on the JADEP list. And of course, you would go to your JADEP participating pharmacy and you would have paid $40 per drug, up to a maximum of $240 for 6 or more items dispensed on the JADEP drug list. And that's, of course, for our person 60 years and over. You also pay less for test strips, lancets, insulin refill pens, and syringes. For our persons who are asthmatic as well, you can get a subsidy or benefit on your asthmatic pumps, your spacers, and your mask as well. Some more benefits here. Our diagnostic test. Our HbA1c is really for a sickler who may be diabetic, and you have your one test per quarter. That is if you are enrolled for diabetes as well, and all other beneficiaries can get one test per year. So this means that once you are enrolled on the NHF program, even if you do not have diabetes, you can get an HbA1c test subsidized each year. Then we move on to the pap smear for our females 21 years up to 64. That's one test every 3 years. And the subsidy is $1,300 per test. If it is that you're a female and you're at severe risk of cervical cancer, you can request more frequent testing. That would mean that your doctor would have written to us explaining your particular high risk, and then we would have possibly increased the amount of tests that you're allowed, that are subsidized for you. Then we move on to the PSA, the prostate specific antigen test. And this is for our gentlemen, males 40 years up to 75 years. So once you are an enrolled beneficiary, once you have an NHF card and you're a male 40 years to 70 years, you can get a test subsidized $1,920. If you are a male 40 to 75 and you have been diagnosed with prostate cancer, you get a subsidy on 4 tests for the year. This one is particularly new, and so not many persons may know about that one. All right, electrocardiogram. And this is for all beneficiaries, 1 test per year. And I'd want you to understand that what it means is that once you are enrolled for one of the chronic illnesses, it means that you have access to all of these diagnostic tests. Once it is that your doctor has ordered it, you can use your card to get a subsidy on these tests. Then we have our breast receptor studies. That's for all beneficiaries who are enrolled for breast cancer. And the subsidy is $12,500 per test. You can get 2 tests in a lifetime. Then we move on to our mammogram, which is one test annually for all females 40 years up to 74 years. And that is one test per year. So as you can see, most of our diagnostic tests, once you are enrolled for any of the conditions, you actually can get access to these tests. And as you can see, the mammogram can be ordered by your physician, or the beneficiary may actually request it. And this is our most,
I
yes?
was gonna ask you what is the subsidy for the mammogram? Is there like a certain amount up to which you will subsidize it for?
Yes. I'm wondering why it is that the mammogram subsidy. It's $3,000 per
Okay.
test. I'm not
Okay.
sure
Okay.
why it is that it fell off the slide there. Right.
Because I was realizing because the others had the amount.
Yes, yes, that should have been there. That should have been there. All right, and our most recent addition to diagnostic tests is our echocardiogram. That's all beneficiaries, and it's one test per year, and the subsidy is $7,500 per test. And of course, as I was actually saying to you about the others, the beneficiaries may access the test regardless of the NHF card chronic condition status. Right, and that is the end of the presentation today in terms of the benefits that the fund actually has available for Jamaicans and for sickle cell patients. I know you may have questions in terms of what has been presented or what has not been presented. So you can go ahead and ask your questions at this point. Thank you for
Just the
listening.
part about the $3,000 about the I think is a mammogram. I just catch the last part there because I went downstairs.
Yes, the mammogram, that's the subsidy on the mammogram. So you get one test per year. A woman who is 40 to 75 years old.
Okay.
So
And that you can
so
go to any doctor, a private doctor with it also?
well, we have a list of providers for each of the tests. So you would actually see that list of providers on our website. As you
Okay,
can
thank you.
understand, it would not be just one or two, it's quite a few of them. And so just type in NHF website and you can actually search diagnostic test, and then it will come up and you will actually see in a little bubble beside it, it will show you the different providers for the test.
Okay, thank you.
You're welcome.
Andrew, go ahead.
Sorry, I was trying to unmute. Can you hear me?
Yes, hearing you.
Hi.
Hi,
I
hi.
think you might have answered my question. I just wanted to find out because I'm finding a lot of times people are saying the machines are broken. They everywhere they go, they can't get a test done because the machines are broken, like for mammograms. And I started to really get into a panic, wondering if that is the case, like where are people getting mammograms done? But
Done, right.
you've shared some really good information today. So there's a list of places you can go. So if
Yes.
you have the NHF card, you pay $3,000 per year. Is that how it
You
works?
right. So it's as you know, it's a subsidy. So it would be
Right.
$3,000 off whatever the
Whatever
provider
the cost is.
requested.
Got it.
Right,
Got
right,
it. Got it. Got it.
right.
All right. And I think one more thing. I think you
Yes.
mentioned you were talking about prescriptions in Kingston, but then I think you mentioned Cornwall and you mentioned Mandeville, right?
Right.
Okay, because I know they have now a sickle cell clinic at Cornwall, but for
Uh-huh.
children, and they have one at Mandeville and they're opening one at in Falmouth at the
Mm-hmm.
hospital. So
Right.
I gather that it would be the same thing would apply in terms of getting things filled. Okay, I think you answered.
Right. Well, what happens is that those other facilities that you mentioned, they are
Yeah.
actually public facilities, and there's a
Okay.
drug serve there that is already a public pharmacy. And
Ah,
so, right. So
okay.
you
So
would have
that's
been
different. That's different. So
right.
NHF is only if for private, if you're working and have insurance. Is
Right.
that
So
it?
the NHF card is really for it's really for those persons who would have had their private prescription and they are desirous of getting a subsidy, a discount
Ah, okay.
on there. But I presented the other pharmacies because that's another arm of the NHF, because we
Yeah,
are actually in charge of the public facilities as well. So I
got
really
it.
wanted just, to share that with you.
Okay, thank you.
Yes, you're welcome.
Okay,
Okay.
so Alicia's hand is up, but there's a question
Sorry.
in the chat from Ali B. I'll just have
Okay.
Mrs. Rathbone respond to that. Once persons sign up, are the cards ready to be used immediately?
Correct. Correct. So once you come with your application form and it is correctly filled out, customer service will look at it and they'll let you know if there's something missing or if it hasn't been completed correctly. But once it is that it's completed correctly, you will get your card within 15 minutes and you can use it immediately. You can walk out and go to a pharmacy and use it immediately.
Awesome.
Yes.
Okay.
Yes, I think
Go
that's super
ahead,
awesome.
Alicia.
Oh, Alicia? Oh,
Yes,
she's
I'm
muted.
here. Can you hear me clearly?
I'm hearing you now. Yes.
Okay. Good night, everyone.
Good
All
night. Good
right.
night.
So first, thank you very much for this very informative presentation.
You're
And I
most
must
welcome.
commend the NHF. I will agree that they do have very good customer service. I use it for myself and I also, assist other persons to utilize it as well. And
Okay,
for most of
good.
my interactions, it has been good, especially for a government entity. We're used to poor customer service, but I must say the service has been very, very good so far. One
Thank
thing I
you.
wanted to clarify, you're welcome. I was driving, so I wasn't able to see the screen. At the beginning of your presentation, you were
Yes.
saying something about a mobile unit.
Right. So, mobile dispensing units would really have been for our patients who are
Hospitalized.
admitted, yes, or hospitalized. It would not necessarily have tied into the individual benefits per se. It really would have been for the public side of the NHF. And so that's really on our wards.
Okay, so once someone is admitted to a public hospital and we present our NHF card to
No,
get medication, how does that work?
no, so the NHF card would not necessarily come in at that point. So if you would have noticed, I really was talking about NHF actually being in charge of the public hospitals and the health centers. And
Mm-hmm.
so that is an initiative that is actually done under the fact that they are in charge of the public hospitals. So the mobile dispensing unit would really be for somebody who is actually admitted on the hospital. So you wouldn't necessarily be presenting your NHF card. It's just that because NHF is in charge of those facilities, it is something that I mentioned by way of information.
Okay.
Right.
All right, thanks for clearing that up. So two other things. Well, one was already answered. I wanted to find out about, the mammograms and EKG, all of that, but you pretty much mentioned that there is a list of participating providers on the website, so that's good. Thank you
Right.
for that. And lastly, I mentioned there are other people who I assist to utilize DrugServe. So
Yes.
there's an elderly lady she's in Spanish Town, Eltham, and
Yes.
we try to fill her prescription there, but most times, often than most, they don't have all of what she needs. I think she has about 6 or 7 medication on the prescription. So we have to
Mm-hmm.
end up doing it at Union Square and Crossroads, and then somehow do some logistics to get it to her in Spanish Town. Can you speak
Oh,
to why, the
so
major
she has a
outlet there?
government prescription?
Yeah, man, it's from a clinic. So we filled it, but we just always just end up filling it in Crossroads because that's usually where we can get all the drugs.
Oh, so what you should do is, so that means she's close to Spanish Town Hospital,
Yes.
right? And which other one is there? I'm thinking of Spanish Town. Right. So what you can do is go and
Or
speak
Harbor.
with the manager there and let them know that you are actually living in that area, close by, and you have these items on your prescription that you'd really love to have filled there. Because what you find sometimes is that um, because you don't want to stock something that
Mm-hmm.
is not being utilized, because
Yeah.
if it's not being utilized, then you run the risk of expiry and all of that.
Wastage, right?
Yes, so sometimes it's good for you to let the manager know that you are close by and you really would love to access the services from the Spanish Town Hospital, and you're asking if these items could actually just be ordered so that you can come there to fill your prescription. So you
Oh,
go,
okay.
just go ask to speak with
Oh,
the
so we'd
manager.
have to go in person. We wouldn't be able to call
Well, you can call too. You can
because
call
it
too.
would
You
be me
can
and
call.
out at work in Kingston. So yeah.
Yeah, man, you can call 906-1106 and you can
Mm-hmm.
ask to be transferred to Spanish Town.
Okay. All right.
Yes.
Thank you so much for that information. That's
You're
it for
welcome.
me.
Okay, Camille, go ahead.
Okay. Yes, I wanted to find out. First of all, thanks again for a very, very comprehensive and informative presentation. Really appreciated it.
You're
Sorry,
welcome.
I had to join late because of my mother.
That's
But
fine.
I wanted to find out, well, two things. One, you had made mention earlier, but I didn't catch it fully, which
Yeah.
was that there is something about medical grant. Is there anything, and you had said, is it a grant like to assist with a particular procedure issue? Or did I
Um,
get confused? I saw
no.
something.
So that was actually put under institutional benefits, and it's another section of the National Health Fund. So that's really when you hear about uh renovations being done at public facilities, health centers. That is
Yes.
really what that is referring to.
Ah,
Right.
okay, okay. Because I was wondering if it was anything similar to the compassionate grant that the Ministry of Health offers, for like particular cases of medical conditions where the patient really can't afford,
Hmm.
like for instance, sickle cell patients who have this problem called avascular necrosis of the femoral head, which is basically when the hip joint is damaged and collapses and they need a hip replacement.
Yes.
A hip prosthesis is like really expensive, maybe over 600,000.
Right.
Yeah, so some persons do apply through the compassionate grant, but of course those funds are limited. So I was just wondering if you guys had a similar type of grant. So I wasn't sure, but this is basically for infrastructure and the public health system.
That's yes, it's mostly for that type of thing. Yes.
Okay, okay. And the other thing I was gonna ask is, had the sickle cell unit mentioned, because I know that, I was part of some of the early discussions about different things that maybe possibly could be done through NHF, but I was wondering, do you think it is possible that maybe a grant to assist with a sickle cell electrophoresis blood test? Because it's usually about 4,000 or more,
Right.
5,000 for that blood test, and I was saying, since you guys are offering some tests like the A1C, which I know is for
Right.
diabetes. Yes, but
Right.
I was wondering, because it's a real barrier for people to actually do that test
Yes.
to find out if they carry the sickle cell trait or any other abnormal hemoglobin. It's like it's out of the reach for a lot of people. So I was saying to myself, I wonder if that's something that we could ask, the NHF to consider going forward, as possibly something that they could assist with subsidizing.
All right. Well, Um, I'm not gonna say it is something that we can definitely do.
Yeah, no.
However, there is a way that you can communicate with us, and I'm going to send the form to Morit when I'm finished. It's an individual benefits form, individual benefit request form. And
Mhm.
really, it's the way how our beneficiaries communicate with us. And
Mhm.
so you would have just as you said to me, you would have
Mhm.
filled it out, and we actually do take what you call it now, a summary of all of them, and
Mhm.
we present it at our medical review committee in terms of what is actually coming out of, what our beneficiaries are actually saying. So
Mhm.
I'm not going to say that it definitely will happen, but it is something that will be tabled for discussion. So I will send that form so you can fill it out.
Mhm.
Okay,
Okay,
sounds
great. Yeah,
good.
because it is not, I don't think, something that there would be a huge demand for. I mean, as you know,
Right.
right now, they're actually screening all babies born. So people who
Yes.
are, being born since 2015,
Yes.
and later years, most of them, their child would have, actually have it on their child passport or the health passport. It would be
Right.
there. But there's so many adults, who are of
Yes.
reproductive age who would have missed that opportunity. It wasn't available for them. So they have no idea.
Correct.
And,
Correct.
the incidence of sickle cell isn't, declining, unfortunately. Although we have more awareness, it's
Yes,
still
I
about
understand.
this. Yeah. So I really was, I guess that's something although, as I said to Morit, many
Hmm.
people don't want to do the test, even though they suspect that they may have the trait. Yeah,
Right.
it's because it could possibly interfere with their romantic aspirations.
Yes,
Yeah,
yes.
they don't want,
I
they don't want
remember
to
we
find
learned that very early in biology.
out.
Yes,
It's
yes,
like, no, I don't want to have another barrier to preventing me from, having a child or
yes.
finding a partner. So yeah, so
Right.
there is, you would think that people hearing about sickle cell and how dangerous it can be would want to actively avoid having a child with sickle cell, but no, there's so
Yes,
many other challenges out there. People just don't want to. Yeah. So I mean, even though we encourage it, I don't
yes.
think, yeah, there'll be a huge demand, but I think that there are some people who genuinely have come
Want
to us and said they wanted to do it, but they just couldn't afford it.
forward.
And
Okay.
yeah,
Okay.
so that's definitely something I'm interested in. But thanks for giving me that the fact that there is a route to put in a
Okay.
request and, possibly have it examined.
Yes,
So,
correct. You're
yeah,
welcome.
thank you.
And not just for electrophoresis, if there's any other drug or anything else that we
Correct. Correct.
consider,
That's
then
what
that
that
can
request
be, yes,
form is
that
for.
request form can be used. So
Yes.
Okay,
Yes.
now we
great.
have that. Sounds good. A
Yeah, thank
question,
you.
yes, a question for you, Mrs. Rathbone.
Yes.
Are there medication that's free of cost, or is it just that the medications are subsidized?
So medications are free of cost when you have the government prescription.
Okay, so walk
But
us through that process.
all right. So when you are seen in a public facility, you're seen in a health center, or you're seen in the hospital,
Or at the
you
sickle cell unit.
or if you are seen at the sickle cell unit. All right, so
And your
let's start with the sickle
prescription
cell unit.
is stamped and it
Yes.
is signed by one of the doctors.
Okay, let's start with the sickle cell unit.
Right.
So for the sickle cell unit, the partnership that the drug serve has with the sickle cell unit is that once you are seen there, it's a UE prescription that you are getting, but you are seen at the sickle cell unit. When you take that prescription to any drug serve, any health center, you get that prescription free of cost. So you do not pay for that prescription.
Okay, so
And
let's
that's,
pause on that. Let's pause on that. And
yes,
just to note that that particular prescription that's received at the sickle cell unit should be stamped and it should be signed by the doctors. So if it is not stamped with the sickle cell unit stamp, or it is not signed, then
correct.
it will be deemed a private hospital
Correct.
prescription. So we
Correct.
just want that to be clearly noted.
Yes, correct.
And so what I'm hearing you say is once that prescription goes to any drug-serve pharmacy, it will be considered, it will be honored free of cost.
Correct.
Okay. So when do you pay the subsidy? Differentiate for us when the medication, when the prescription is subsidized versus when it's free of cost.
All right. So those persons, because not everybody goes to the sickle cell unit. Not everybody would have gotten a prescription from the sickle cell unit, correct?
Or a Cornwall Regional or a health center.
Right. So what I should state though is that once the item on your prescription is on the government's list of drugs, so you do understand that not all items are covered. So the hospital and the health center formulary in terms of the drugs that they carry is actually governed by the VEN list, which is the vital, essential, and necessary list. So there are items on that list that the drug serves carry. So once it is that item is on the VEN list, you will be able to receive it free of cost. The other items that are not VEN list items, then you can use your NHF card to get the subsidy at that time. For example, lisinopril is for high blood pressure. However, lisinopril is not a VEN list item. However, it is an item that is covered under the National Health Fund program. So it means that you can use your card and get a subsidy on it, but you would not be able to receive it free of cost at a drug serve. I'm not sure if that is clear.
Because it's not on the VEN list.
Correct.
So, just to jump in, basically then, if there was a sickle cell patient who had high blood pressure, let's say as a result of kidney disease, and they
Yes.
needed to get that particular blood pressure medication, they would
Yes.
need to have a doctor actually sign them up for hypertension as a separate condition, so they could get the lipronosol or whatever the name you just called under hypertension, because that drug is not under sickle cell. Is that how
No,
it
man,
would go?
that's not what I meant. So once you are signed up for sickle cell, hypertension is listed on the program as an adjunct, as a condition that you can have while you are actually a sickle cell patient. So once you're signed up for sickle cell, you will be able to get pressure medication. And I'm going to show you closer to the end the different list of drugs that are under sickle cell. It's quite a few, but you will get a chance to appreciate it a little more when you see the list. So once you sign up for sickle cell, say the doctor wrote lisinopril for you,
Yes.
you will need to go and now sign up for hypertension. You're signed up for sickle cell, so you will now be able to get that benefit right away.
I didn't know that hypertension
Yes.
was as a condition attached to sickle cell, because so many of them do
It
get
is.
that.
I'm going to show you the list.
Yes.
You want me to show you the list now?
So there are two lists, but I think what we need clarity on are
Yes.
those conditions that you consider the adjunct conditions.
I'm
So
going to
if
show
you have sickle cell disease and you have these other conditions, then
Yes.
you will also benefit from whatever the associated prescription items are.
Yes.
Right. I wasn't aware about this. The adjunct disease is attached to sickle cell registration. That's good to know.
Let me just bring up the sickle cell disease arsenal of drugs, and then you can see what I'm talking about.
So it's two different set of information, Mrs. Ralph Brown. We want clarity on
Yes.
the other conditions, the adjunct conditions first. So if you could tell us what those adjunct conditions are, and then you can walk us through the list of conditions, list of drugs.
All right. When I bring up the list, the
Okay.
conditions, you will see it as well. So we can do it at
Okay.
the same time.
All right, not a problem.
All right. Why am I not seeing it? Are you seeing my screen?
Yes, but it could be expanded though.
All right, so you want it to be a little bigger.
Mm-hmm.
How is that?
Okay, but we're just not seeing all the, can it,
How is that?
all right, let's see.
That is good, but we're not
Yes,
seeing the adjunct conditions. We're seeing the
I
drugs.
guess we'll come to, she'll take us
You're
through.
gonna see. All right, so as we go through, I'll just say the different conditions. It's not
Okay,
gonna show
sure.
you, but I'll just say them.
Okay,
So,
great.
sorry. So as you can see, this is aceclofenac is analgesic. So that's pain. So all of these here, aceclofenac, aceclofenac CR, and if you have gotten a painkiller, you will actually recognize some of these, correct? Then you have amitriptyline. Amitriptyline is thought to help with nerve pain. It also helps with inflammation. That's amitriptyline there. Then you have amoxicillin. And this is giving you the different labels of amoxicillin that are available on the NHF program.
Yes, I think sometimes some patients will have to recognize that because these are mainly generic. You sometimes have to look at your actual medication that you take and
Yes,
see the actual name of the drug itself. And yeah, because sometimes you may not make the connection.
right. So this here, so amoxicillin and clavulanic acid is the name of the drug. And then augmentin
Is the
is
brand.
a brand. Co-amoxiclav. We don't say brand, we say labels. We call them labels. So
Yeah.
all of these are labels. And it means that all of them contain amoxicillin and clavulanic acid, but they are all on our program. So if you go to the pharmacy and they have Curam 1 gram, but they don't have Augmentin 1 gram, you can still go ahead and get a subsidy. You understand?
Yes, yes, definitely. I meant to ask you, did you guys eventually add ciprofloxacin? I had asked Professor Knight to add that to the list of drugs being requested, but I'm not
All
sure if
right.
it.
Well, it's ciprofloxacin is we can look into that. Ciprofloxacin is on the program, but it is not there for sickle cell. So
Okay.
I can investigate that particular request.
Yeah, well, I know that one was a drug that is prescribed a lot for ulcer infections, like ulcer infections. Yeah, so
Okay.
yeah, with the ciprofloxacin. But I remember putting it on the list when we were, having that discussion some years ago, and she said she wasn't sure if it was actually going to be added for sickle cell. But
I
now
can
that
make
we
a
know
note of
that,
it.
there's that channel, we can definitely fill out that request. Yeah.
Right, right. And as I said, that form, we those forms, they don't just come and sit. We actually look at them and they are tabled. So this is azithromycin, that's another antibiotic. And now we are gone into the beclomethasone, which is a bronchodilator.
So basically, asthma
So
is another
what
adjunct
it means,
disease. Asthma.
yes, so what it means is that if this drug is prescribed for you and you are signed up for sickle cell disease, you will be able to get a subsidy on it. Is that understood?
Yeah, well, I think that's excellent because, as you know, many persons with sickle cell also have asthma.
Right.
Lots of children are suffering with both, and Even if you don't have asthma, you have so many upper respiratory tract infections throughout your life that sometimes you have to take these inhalers anyhow for a period of
Right.
time.
So the reason why I didn't want to say condition is because it's not every drug that is under asthma that is linked to sickle cell.
I understand.
Right. So that is why I said you would understand it a little better when I go through the list, and you will see that there are some drugs that are covered under asthma that are actually covered under sickle cell as well. Meaning that, as I said, if your doctor writes a prescription for any of these items and you are enrolled for sickle cell, you will be able to get the subsidy. All right, so this is diclofenac potassium. That's your cataflam. I think most persons know cataflam. Right, so that is the subsidy. And the subsidy is to the right. That's the amount that it pays per tablet. Cataflam drops would be for our children. Cataflam suspension. And that is the amount. In this case, it's $1,612.60 per 15 ml drop bottle. It's cataflam drops, but it's a 15 ml bottle.
Is that the same thing as what I hear patients referring to as liquid cataflam?
So you have, it would be the same thing. Yes, you have the 120 ml bottle, and then you have the drops. The drops is normally for the babies, but sometimes the cataflam suspension is not available on the market, and we have to recalculate using the cataflam drops. So it's the same thing. It's just a different dosage, the way that it's formulated, but it's the same drug.
Okay, because
Right.
I was hearing one of the patients saying that liquid cataflam is not available on DrugServe, but I was saying, well, maybe it's available on NHF. So now you're saying, yes, it is actually
No,
available.
so liquid cataflam is on the ven list. So you can actually get it at the DrugServe as well.
Really? So this patient
Yes.
is under the wrong impression.
No, yeah, man. Cataflam is on the ven list from the year of North.
Maybe it's a case that he maybe went and it was had run out of stock while he said he couldn't get it at DrugServe. Maybe it's not on the list, but maybe he didn't get it at that time.
Yes, there was a time when because the most popular one was the brand Cataflam. And then we weren't able to get the brand, and then a generic came, which I think it was I'm not seeing it here, but it was the MK brand, some other brand. But we always stock Cataflam. So it is actually on the ven list as well. So it means that if it is written, for example, on a UE sickle cell unit prescription, you would be able to get it free of cost at the DrugServe.
Okay, well, I will be sure to inform him of that because I wasn't certain if it was that he thought it wasn't at all available or just maybe out of stock at that time. So I'll let you know that it's something you carry on the sickle cell.
Right. And then diclofenac sodium is another pain medication. And you'll see those there. All right, so all of these are painkillers. You were asking me about the Daflon. Here's the Daflon. So Daflon, Divanise, Venalon, those are the different labels. Now we're gone down to enalapril, which we know is for high blood pressure. And these are all the different labels of enalapril, all the different strengths. So you can note those. Then we have another antibiotic here, erythromycin. We have etorecoxib, which is another painkiller. That's our non-steroidal anti-inflammatory. Then we have folic acid, and I know the sickle cell community is familiar with folic acid. Hydroxyurea, that's our anti-metabolite. Ibuprofen is another NSAID, which is for pain. And we have Sufrexol gel, which is for our ulcers. So those
With
of
a high subsidy. The subsidy is 5,000. So that's
yes, it's 5,500 per tube. And then we have, I was mentioning lisinopril. So As I said before, if it is that you are a sickler and you are prescribed any of these drugs, it's not that you are going to go now and sign up for hypertension. It means that you will be able to get a subsidy on these drugs. There's losartan potassium, and you would have been familiar with Resilo for losartan potassium.
Yes,
Cova.
but tell me something though. Is that possible though that a doctor could add hypertension as a separate condition on your NHF card? Like if you wanted maybe to access another hypertension drug that's not on the
They
sickle cell
could.
list?
If
Mhm.
it's they could. They could.
Okay.
I'm
Okay.
I'm just showing you that because of the fact that the sickle cell disease, it comes with other spin-offs, other things that would have happened to you just as a result of being a sickler. We're not no waiting to say, okay, have you sign up for hypertension, because some of these things are happening to you just by nature of the fact that you are a sickler. You have the sickle cell disease. Um,
Mrs. Ralph Brown, Roxanne has her hand up. So
oh,
let's
I'm
hear.
not seeing the hand. Sorry.
No, that's fine. I'm just letting you know.
Right.
Roxanne, you can unmute and ask your
Hi.
question.
Okay, thank you. Good evening. All right,
Hi,
so
Rosa.
my daughter, she has sickle cell. She's currently 13.
Yes.
However, I signed up for the NHF card a few years ago.
Right.
However, when the doctor was filling out the form, there was a part that was asking for if the sickle cell was mild or something
Severe.
like that. Yes.
Yes.
So
Right.
she had ticked the mild option.
Right.
So when I went to use the NHF card, they were telling me that I couldn't get the cataflam on a subsidy because the option that was selected was mild.
Can that be updated?
Yes, it can be updated. It can be updated. So what you need to do is just have your doctor, that same form I showed you.
Right.
Ooh. Do you remember the form, or you want me to bring
Yes,
it
the
back up?
yellow form. Yes, it's the registration form.
Right. There's a
Right.
section at the top that says change request.
Okay.
So the doctor is going to tick that area, and then at the bottom, he's gonna tick sickle cell, and then he'll tick severe.
Okay.
So that's the change that he wants to make to your particular profile.
Okay. Thank you so much for that. Another thing, I
Yes.
went to the pharmacy maybe about 2 months ago to fill another prescription. And I
Yes.
asked them if they accepted the NHF card for her sickle cell, and they told me no.
Was it a drugstore pharmacy?
No, no, it was a private pharmacy.
That sounds a little strange. I'm wondering if they understood what you said.
What I'm
You
thinking that they're not aware that sickle cell is now on the NHF card. That's what I was thinking.
okay? So how long ago was that?
Maybe 3 months ago.
Oh, probably. But sickle cell has been added for a while now. But
I know.
once it is that they are a NHF provider, meaning that they are a participating pharmacy, which is almost all pharmacies in Jamaica,
Mm-hmm.
it means that once they have the drug in stock, you can go and swipe your NHF card and get the subsidy.
Okay.
Yes.
Yes, actually, once you hand over your NHF card, once they swipe it, they will see all that is covered, whatever has been registered for your child. So
It,
yeah, you don't
they're
even
not
have to ask them.
necessarily, no, they're not going to see everything when they swipe the card. They'll have to put in a drug. They'll have to
Oh,
put
they
in
have
a
to.
drug on the prescription. Yes.
Okay, because I've never ever asked a pharmacy, do they cover anything for sickle cell? I just hand my NHF card, hand my prescription, and
Right.
I get the subsidy. I don't ask any questions
Right.
because
Right.
I know that sickle cell is on my card. So yeah, and I always get, if whatever it is, I get the subsidy. But
Right. Well, probably
sometimes they might be confused by your question and not understand fully what you're asking.
right. Or it could be that, because it sickle cell wasn't always on it. It could be that they just didn't know that it's actually on it. No, I'm not sure. But normally you don't have to go and say the condition that you have. You just present your prescription and your card.
Okay, a final question for you, Mrs. Rathbone.
Yes.
Any advice you'd give us to help maximize the benefits available through NHF?
Any advice to maximize the benefits? Well, what I would say, I think we have said already. If you have comments or you have suggestions or recommendations, you can use the individual benefits request form as a tool to actually, write and let us know exactly what it is that you don't like or what you would love to see us do. But that is really it, because we have put this list of drugs together based on industry data and based on the standards and guidelines that govern treatment of these diseases. But of course, healthcare and treatment of diseases is quite dynamic, and so it does not remain the same at all times. A treatment that may have been gold standard 2 or 3 or 4 years ago may not be the gold standard today. And so that is the reason why we constantly have to be assessing our program and listening to what our beneficiaries are saying, listening to what our industry experts are saying, so that we can actually keep our list abreast and up to date and current with what is actually happening. So we are always open to getting feedback from you. We actually love to hear from our beneficiaries, because that is how we keep, apart from the fact that we do our own reading and keeping abreast of what is happening, learning and hearing from your beneficiaries is also a very good way for us to know what is happening out there, and to ensure that persons are actually getting the best out of the benefits that we are providing. Because the truth is, if what we are providing is not helping you, then we're not meeting our goal, and we really are. It's important to us that we meet that treatment goal.
Awesome.
Yes.
Is this Venn list available on the website? So how can we access this Venn list?
The Venn list is not on our website. It would have been, it's a Ministry of Health document. So it really would have been on the ministry's site. Because remember that the NHF is really a subsidiary of the Ministry of Health. Right. So it would not have been on our site, but it would have been on the ministry's site.
So you're saying we can access it on the Ministry of Health website?
The Venn list, yes.
Okay.
The vital, essential, necessary list. And that list is what it shows you. It's a book. So I couldn't even begin to tell you. It's just that because I've worked to tell you everything that is in it. But because I've worked with it for many years, I can look at a prescription and I can tell you this is on the Venn list. No, this is not on the Venn list. But as I said, accessing it, you can go to the website and you should be able to see that Venn list. So you can actually see what is covered at the drug serves, because really that is what governs what we decide is free from what is not free. As a matter of fact, we would not have had. It's only what is on the Venn list that we would have procured. So that's basically it, right?